Virginia's coronavirus positivity rate is the highest in the region, and with case numbers continuing to rise, Governor Ralph Northam began new measures to slow the spread within the state. But there is light and hope for the pandemic's end as an FDA committee takes up a second vaccine that we talked about that would happen later this morning. Joining us now to talk about the coronavirus and more impacting Virginians is Governor Ralph Northam. Good morning to you, Governor. Thank you for joining us this morning.
Good morning, Jeanette. I hope that you and your viewers are staying safe and healthy. Thanks for having me on today.
Of course. Happy to have you. I want to jump right into this Moderna vaccine that's set to be approved later today, possibly. Talk to us about how that would impact Virginia's fight against the virus, especially as we're in the middle of this surge.
Well, this has been an exciting week for Virginia, and I know this country. We received 70,000 doses of the Pfizer vaccination on Monday in 18 different hospitals. That's now going into people's arms as we speak. So we're very excited about that. We anticipate and hope that Moderna vaccination will get approved today or tomorrow. That will be an additional 140,000 doses for Virginia. So we're making a lot of great headway, Jeanette, especially with our frontline healthcare workers. Also in that first phase, we want to get into our long-term care facilities, both the residents and the employees. So we're making progress, but I think you made a great point in your introduction. We are still seeing concerning numbers in Virginia. We had about 3,800 new cases today, over 40 additional deaths. The coronavirus is alive and well, and Virginians really have to be vigilant. We have to continue to wear our masks, keep our social distancing, wash our hands. And as we deploy this vaccination, Jeanette, we have to be patient. But we've been working on this for several months. We're going to do it right here in Virginia. We always do. And I just encourage Virginians to be patient. Also to understand that this is a safe and effective vaccination. And I encourage all individuals, when their time comes, to please take the vaccination. That's the only way we're going to get this pandemic behind us. But it is the hope, it's the light at the end of a long, dark tunnel.
Right. And Governor, speaking of that, as far as the vaccine being safe and effective, as you know, there's been a lot of reluctance from a lot of people who say they don't feel comfortable taking it. Would you take that vaccine publicly to reassure the public, specifically Virginians, that it is safe to take?
Absolutely, Jeanette. You know, I'm a physician. I've participated in a number of clinical trials over my years in practicing. I've followed the data. It's the efficacy rate is close to 95%. We're confident that it's safe. As you know, my wife and I both had COVID-19. We were fortunate that we had mild cases. Obviously, everybody's case is not mild, but when our time comes, my wife and I will be glad to take the vaccination.
And these next few questions here are from our viewers, Governor. I want to get through this really quickly so we can get to all of them. The first one that we have here is people wondering whether or not you have any thoughts on schools reopening for in-person learning. They want to know, could we see more schools reopening after winter break? You know, it's been really tough for parents here having their kids doing virtual learning for so long.
It's a great question, Jeanette. And this pandemic has been very difficult for really all Virginians, but especially our children and their families. And we know that our children need to be back in school. That's where they learn best. That's where their social interactions take place. So we want to get our children back in the classroom just as soon as we can, but we want to do it safely and responsibly. And you know, we've planned for the rollout of this vaccination. So that after we have this phase one of our healthcare providers and our long-term care facilities, we want our essential workers to then be vaccinated, and that includes our teachers, our food processors, first responders. So as soon as we can get our teachers vaccinated and it's safe to get back into the classroom, that's the initiative that we need to take across Virginia.
All right, last couple questions here. What resources do you have for children struggling mentally, specifically as it relates to online and virtual learning? Will there be any help provided for parents and families who are having challenges with this?
Absolutely. And mental health is just so important. Again, I'm a child neurologist. This is what I've dealt with most of my life. And we know that students and their families have suffered. So we introduced our budget yesterday, Jeanette. We're putting over $500 million in education, and a lot of that will go to school counselors to make sure that the ratio between the counselor and the students is decreased, and that we can reach out and make sure that we're taking care of all of our students. So very important as we come out of this pandemic.
Okay, and last viewer question here, Governor, switching gears a little. They want to know, where are you on the legalization of marijuana in the state? We do know that the Senate Majority Leader here in Virginia said that there's a 50-50 chance of it passing its chamber, and we know you're going to be introducing this legislation in January. So where do you stand on this?
Well, that's a large part of our initiative going into this session of 2021. I think the time is right. There are 15 other states that have legalized marijuana. We're going to do it the right way, really promoting health, equity, small businesses. And so, I think about 70% of Virginians now agree that we need to legalize marijuana. So I'm supportive of that, and it's going to be a large part of our initiative in the 21 session.
All right. We appreciate you talking to us. I know we covered a lot of ground, but I know our viewers also appreciate you answering their questions. Thank you, Mr. Governor. Appreciate it.
Thank you. Happy holidays to you.
Same to you. Be safe. Wisdom, I'll send it over to you.
All right. 9:21 is the time.